Hi, my name is Christoph Sommer. I'm a Heilpraktiker. That's a German naturopathic medicine man, as you call it here in America. And I'm actually treating manually since 24 years. And since 20 years, I'm using Jean-Pierre Barral's and manual techniques in the fine art of osteopathy that he has developed. I'm here to speak about the neuromeningeal approach to trauma and to the nervous system that he has developed lately to you, and why that is so important. So after developing the visceral manipulation, which is a well-known method with manual therapists for sure, and has treated a lot of people very successfully with unease and dis-ease, Jean-Pierre Barral and Alain Crobier have developed their response to mechanical trauma. Mechanical trauma being falling down the stairs, being crashed by a car from behind, being crashing into a car in front of you, and the effects that it does have, especially in the soft tissues of the body. And in this case, we have followed what it does to organs before. In this case, what it does to the brain and the connective tissue around the brain and the spinal cord, ending into the tentacles of the nervous system itself. So, as we know now, scientifically proven, nerves and neurovascular bundles are transporting the tension directly, whereas muscle tissue and muscle fibers are much more distributing any tensions that happen to a body. So this method is actually in the NS1 course, as we call it, looking at the neuromeningeal, that means the cranium, the head, the bones, the membranes, and the brain itself. And then it's split down into the dura, going down to the sacrum, and starting with the bigger branches of nerves branching out that can transport and maintain and repeat stress that then creates disease for you and your client. So NS3, as we call it, is mainly treating the lower part of the body, the lumbar plexus, the sacral plexus, and the coccygeal plexus, with the famous sciatic nerve, where all of us practitioners have some not successful treatments. That means we don't have sustainable results. Now, this nervous tissue itself is connective tissue, is a very strong connective tissue, is a very hydrated, fluid, vascularized tissue, has nerves that innervate the nerve and tell the brain what's happening there. And Jean-Pierre Barral has developed ways of treating this nerve tissue directly itself so that you have sustainable results in your practice after all the other techniques you have done and didn't have sustainable results. And last but not least, I must say that we're having the NS4 course, which is the top end of the brain and nerve tissues, which is the cranial nerves itself and the brain itself, that has a sponge-like vascular elasticity that can be in trauma and in any kind of disease that may happen or falls on the head, will show as a density and as an incapacity of good blood flow and easy reality in the brain. Okay. That is what I have to say about this. I hope that got you interested, and we may welcome you in one of our courses that run subsequently. Thank you very much.